Would you take a pill that could kill you within minutes, even if it was perfectly legal in some countries? Prepare to uncover the most dangerous and lethal medications known to science. What you are about to learn is not science fiction. It's the stark reality of pharmacology. These substances, sold in pharmacies, administered in hospitals, and prescribed by doctors, walk a razor-thin line between healing and harm. Some were designed to save lives, others to end them. In the right hands, they become powerful tools for recovery. In the wrong hands, they become silent weapons. What do these drugs have in common? Sometimes a microscopic detail, a barely perceptible change, can mean the difference between life and death. Across the world, medications are both miracle and menace. Their effects can be as profound as they are perilous. The secret lies in the dose, the context, and the knowledge of those who wield them. Let's delve into a list of the world's deadliest drugs, exploring their names, their intended uses, and the documented risks they carry. First on the list is fentanyl, a synthetic opioid that is up to 100 times more potent than morphine. Its medical use is legitimate and often life-saving. It provides anesthesia and relieves severe pain, particularly in surgeries and for terminal cancer patients. But just 2 milligrams, an amount no bigger than 2 grains of salt, can trigger a fatal overdose. It's so powerful that accidental exposure, even through the skin or inhaled powder, can be deadly. While it has revolutionized pain management, it's also at the heart of a global opioid crisis, fueling thousands of deaths each year as it's trafficked illegally and used without medical supervision. Next is digoxin, a medication extracted from the foxglove plant digitalis. For centuries, it has been used to treat heart failure and certain arrhythmias, helping the heart beat stronger and more regularly. But digoxin's therapeutic window, the gap between an effective dose and a toxic one, is alarmingly narrow. Even a slight overdose can cause the heart to beat erratically, leading to deadly arrhythmias. In the Middle Ages, it was a favored poison, and even today, it demands constant vigilance and precise dosing. Clozapine stands apart as a powerful antipsychotic, often reserved for severe cases of schizophrenia that resist other treatments. For many patients, clozapine offers hope where none existed, yet it carries a shadow. It can cause a granulocytosis, a rare but potentially fatal side effect where the body's immune system collapses. Without white blood cells, even a minor infection becomes life-threatening. Patients must undergo regular blood tests, sometimes weekly, to catch this complication before it turns deadly. Insulin is a household name, an essential hormone for people with diabetes, allowing them to control blood sugar levels and lead healthy lives. But its life-saving power is matched by its danger. Too much insulin, or an accidental double dose, can cause blood sugar to plummet, leading to hypoglycemia. Within minutes, a person can lose consciousness, slip into a coma, or even die. The line between therapy and tragedy is so thin that precision is everything. Cisplatin is a cornerstone in cancer treatment, attacking and destroying malignant cells. Its success stories are countless, but it comes with a high price. Cisplatin is incredibly toxic to the kidneys, can cause permanent hearing loss, and inflicts damage on the nervous system. Its administration requires meticulous calculation and constant monitoring. Doctors must balance its life-saving potential against severe side effects, a battle fought in oncology wards around the world. Lidocaine is known to many as a numbing agent for dental work or minor procedures. However, when administered intravenously, in large doses, it becomes a potent toxin. High levels can cause the brain to misfire, leading to seizures, and ultimately, the heart may stop altogether. Even a well-intentioned mistake in a hospital setting can turn this common anesthetic into a silent killer. Warfarin, a widely used anticoagulant, is prescribed to prevent dangerous blood clots in patients with atrial fibrillation, artificial heart valves, or a history of strokes. Yet its margin of safety is vanishingly small. Just a slight alteration in dose, affected by diet, other medications, or even genetic factors, can shift the balance from preventing clots to causing unstoppable bleeding. Patients on warfarin must undergo frequent blood tests to ensure their blood isn't too thin or too thick. Etomidate is an anesthetic used in emergencies, especially during rapid intubation. It's designed to act quickly and wear off rapidly, minimizing side effects. However, when used repeatedly or for prolonged periods, etomidate can suppress the body's ability to produce cortisol, a hormone essential for surviving stress. Without cortisol, blood pressure crashes and the body's response to illness collapses, turning a life-saving drug into a potential danger. Potassium is vital for the electrical rhythms of the heart, ensuring each beat is strong and regular. But intravenous potassium, especially when administered too quickly or in excessive amounts, can stop the heart almost instantly. Hospitals classify it as a high-alert medication, one that demands double checks, strict protocols, and constant vigilance. A single calculation error can have irreversible consequences. Finally, there's Paxlovid, a combination of the antivirals nirmatrelvir and ritonavir introduced to treat COVID-19. For most, it's a beacon of hope, but it interacts dangerously with a long list of other medications, including some used for heart rhythm, cholesterol, and mental health. The wrong combination can cause catastrophic side effects, from liver failure to fatal heart rhythms. Physicians must review a patient's entire medication regimen before prescribing it, making life-saving treatment a delicate balancing act. Why are these medicines so dangerous? According to clinical pharmacologist Dr. Louise Takeda, many of these drugs are considered high risk because their therapeutic window is extremely narrow. The difference between a dose that heals and a dose that harms can be almost invisible. Toxicologist Dr. Helena Azevedo adds, "It's a common mistake to think that medicine is always safe. The context, the dosage, and the route of administration are crucial. That's why self-medicating with certain drugs is like playing chemical Russian roulette. But the danger isn't confined to mistakes or ignorance. History is filled with stories of espionage, intrigue, and assassination, where these very substances became instruments of power and elimination. Some of the world's most infamous spies and political leaders have exploited the lethal potential of medicines, using them to eliminate adversaries without leaving a trace. In the shadows of world events, a pill, a vial, or a sip of poison-laced tea has changed the course of history, leaving only mystery and suspicion behind. The truth is sobering. The world's most dangerous drugs aren't hidden away in secret laboratories or reserved for action movie villains. They're on the shelves of pharmacies, in hospital cabinets, and sometimes in our own homes. They are indispensable tools for healing, yet their power can be devastating in the wrong hands. The line between cure and poison is drawn by knowledge, responsibility, and respect for the incredible and sometimes frightening power of modern medicine. As we marvel at the miracles medicines can perform, it's essential to remember that every remedy carries risk, a risk that must be managed with care, wisdom, and humility. When the cure becomes the poison, the danger is closer than you might ever imagine.